start with talking about, yes, some of the health challenges that face the Muslim community and tie it into the work of the Muslim Doctors Association.
Thanks, Zain. Assalamu alaikum to all the listeners and viewers of the podcast. So thank you for that overview of Muslim Doctors Association. And as you said, there are 3 strands of work that we do. And we started off initially focusing on health promotion, so doing community outreach work in response to various health challenges that we saw. And briefly, if I break them down, we know that the Muslims in the UK experience some of the worst health inequalities, or I prefer to use the word health inequities. So let me just pause there. So I'm just conscious because I don't want to start talking about health, like clinical topics that you're going to be covering, because that's what you're doing, right?
Yeah, doing the health screening or the health promotion stuff, health inequities.
Yeah, okay, so maybe I can just do a quick brief overview and then I can pass over to you to talk about the health.
Yeah.
Okay.
And then I can talk about the specific areas.
Exactly. So, in particular, so around health promotion, we know that people from the Muslim community are less likely to, for example, come forward for screening. There are challenges within mental health, women's health, cardiometabolic disease as well. And within health policy, we know that the majority of health outcomes are socially and structurally determined. The conditions in which people live, work, grow, and play are the most important factors that determine a person's health outcomes and therefore determine health inequities in a population. And we know from data taken from the census that if you are Muslim, you're more likely to live in poverty, you're more likely to experience barriers in the labour market, you're more likely to live in poorer quality housing, and all of these things impact your health. And then when we look at equality, diversity and inclusion, we've published a few reports that look at the experiences of discrimination, racism, Islamophobia in the NHS, and what the impact of those negative experiences is on the healthcare workforce. And obviously that's really important at the moment because we are experiencing crisis in our workforce, and also for patients, they are waiting for an extraordinary length of time to see a healthcare professional, and yet we have healthcare professionals who feel they're not being valued in the work environment and are leaving at record numbers.